All right, now let's assess fluid. So again, in our initial assessment, we noticed that the fluid looked normal just visually, but people like measurements, and we're going to talk about doing an AFI properly. So we want to divide the stomach up into 4 quadrants, a line down the middle and across her belly button here. We'll begin in the upper left-hand quadrant, doesn't matter where you begin. People ask me, should I take this measurement in a transverse plane or a longitudinal plane? And the answer is it doesn't matter as long as you're perpendicular to mom. This is an AP, anterior to posterior measurement, so whether you're longitudinal or transverse, it's the same plane. So we find a nice pocket of fluid, and a couple things to keep in mind is to not put too much pressure on mom, because you can squish the pocket. You can see visually when I put pressure, I'm making it a smaller pocket. When I release pressure, that's a nice big pocket, and this is a more accurate measurement. So that's one thing to keep in mind. Another thing to keep in mind is to not have your gain too low. If you have your gain too low, you could miss cord, and you can actually include some umbilical cord in your measurement, which is incorrect. So you want to turn your gain up enough to be able to see cord. Another trick with the cord is to put on color. So Elizabeth images very nicely, so I can clearly see where the cord is, but as the pregnancy progresses and the fluid gets naturally less and less, there's going to be more cord, and to distinguish it, it's always a great idea to put on color. And so I can see here that that's a big pocket without cord. Another question people ask is measuring a pocket of fluid with an umbilical cord within the pocket. And it's okay to measure the pocket with cord in there, but you can't include the cord in your measurement. So for instance, in this pocket you can see that there is cord, but when I measure, I'm going to go to calc. When I measure, I'm not going to include the cord within the measurement, but it's okay that it's in the pocket. So that sometimes that's confusing to people. So I'll take that picture, and then I just maintain this perpendicular position with the transducer and scan down. Remember not to put too much pressure. You see, I can increase the pressure and just totally reduce the amount of fluid in that pocket. So when I let off pressure, this is a nice pocket. Again, add my calipers. So I've done left upper quadrant, left lower quadrant. I'll do right lower quadrant. Here, it's a nice pocket. I calc Q3. And then up to the left upper quadrant. So again, here I see cord in the image, so I want to make sure, let's put some color on just to be safe. That's where her cord is entering her placenta, which is a real peripheral insert there, so we can keep an eye on that. And I just want to angle down a little bit to get the cord out of position. I don't want to include it in that measurement. So what I'll do here is I'll actually take the measurement like this. I don't want to include that cord. So our AFI is 10, which is normal. I could actually get this a little bit better by coming up further. And again, here's a nice image of this reverberation artifact. You can see it in the near field here. So to get rid of that artifact, you can reduce your gain, or you can just reposition. As I come down a little bit, then you'll see that that artifact will go away. So this is actually a better pocket than the one I was going to originally take. I'll do Q4. I'll include it like that. So 11.5, very normal. And again, to keep in mind that this is a subjective measurement. The baby moves. You want to try to get this measurement done in rapid succession, so you don't wait between taking one quadrant and the next, because the baby will move and it'll incorrectly measure her AFI. But overall, just keep in mind those few things that don't have your gain too low, use color if you need to, keep your probe perpendicular, and your measurements in a true AP. And that's your AFI.